COVID-19 on the coast, and time for our weekly discussion with Santa Barbara County Public Health and the Director of the Public Health Department, Fondo Reynoso, joining us here on Midday. Good to see you again. All right, let's start with Cal OSHA and the flip-flopping that we have seen over the last week for mask rules in the workplace. Why can't we get a simple answer on what's going to happen on June 15th?
I think, good morning, Joe.
Good morning.
I think that's the million-dollar question. I think that the Cal OSHA is being responsive to the CDPH and the Health and Human Services Secretary, Dr. Ghali, in recommending that we all have a consistent recommendation or guidance around masking. So we're hoping, it is confusing, quite confusing. So we're hoping that come June 15th, we will reopen our economy with very clear direction about masking. And then Cal OSHA, I believe, is about revise and relook at the workplace rules on June 17th.
So we've had a couple of weeks here from when the CDC said, hey, here are the new rules for masks. And then we've had kind of California saying, okay, we're going to catch up with that on June 15th. I know you don't work for Cal OSHA. You have nothing to do with them. But when it comes to public health, you're the face of our county for this. What's the problem? Why can't they get this figured out before June 15th?
You know, again, I have no idea. It seems very simple that the state should be in alignment with CDC guidance, and CDPH is certainly there. Now we just need Cal OSHA to be in lockstep with what CDPH is saying so that there isn't that confusion.
All right, so once we get to June 15th, what is that going to look like? I know a lot of people are waiting for it. What will June 15th look like in Santa Barbara County?
June 15th is the big day that we're all awaiting for. We can be certain that on June 15th, California will discontinue the tier structure that has helped our state manage the spread of COVID-19. All business sectors will be able to return to the usual operations with limited exceptions for mega events. Employers, however, will still need to follow the current Cal OSHA guidelines. So we are looking at June 15th as the beginning of return to normalcy.
Now, we just got to the yellow tier earlier this week, so we're going to have about a week here playing the yellow before this all disappears. But it's still a big deal for businesses that may still be struggling to get people inside. So kind of break down the yellow tier, and even though it goes away next week, why it's so important.
It is important, you know, to notice my yellow
I
flower
see that.
to note the yellow tier. You know, it's a moment, even if it's a week, it's a moment for us as a county to celebrate. We are one of the 5 counties that reached the yellow tier this week. And, you know, before I get to the businesses, I do really want to pause and thank everyone for doing their part in getting us here. Being here in the yellow tier is a direct result of countless effort by community members, by community partners in doing their part to stop the transmission and to ensure access to vaccine. So what being in the yellow tier means, the key changes is occupancy being expanded for most business sectors. Bars, for example, being able to provide indoor services at 25 capacity, and that allowances for more activities being able to occur this week with more people.
Let's talk vaccines. There's still this discrepancy between North County and South County. People have been asking, you know, we've had successful drive-through events here in the South County, but we can't think of any that have happened up north. Are there plans to do some more outreach to get more people? And why is there still that gap in North County opposed to South County?
Actually, we do have plenty of vaccine opportunities
Yeah.
in North County. We have it at the Fair Park, and we have it via Dignity Health, and we have it via the Public Health Department, and we have it via the various community healthcare centers as well as community providers. I think that it's a complicated situation where there may be vaccine hesitancy, but certainly there is not a lack of vaccine opportunities. So what we're doing is we are partnering up with the state, we're partnering up with community organizations, with community trusted leaders to really ramp up and making sure going door to door, going to swap meets, going to strip malls, going basic to churches, schools everywhere, to ensure that all questions are being answered and that people, the community in North County will get vaccinated.
At a certain point, do you wonder if, it's easy to get a vaccine. You don't even need an appointment anymore. Do you wonder if there's just a point where, you know what, we've done the outreach we can. If somebody doesn't want to get a vaccine now, we can't help them?
I think it's a progression. What I'm hearing this week is just conversations around when I ask people, why aren't you vaccinated? What I'm hearing is, I'm young, I'm healthy, I am safe. And if I get COVID-19, no big deal because I'll be asymptomatic. And so the conversation is changing where we are saying now, that's great that you're young. That's great that you're healthy. That's great that you can assume that you are going to be asymptomatic, but you need to get vaccinated to protect the other community members, your loved ones, your family, your friends who may not be able to get vaccinated, and if infected, who may not have good outcomes. And so I think it's a progression. We can't give up. We need to continue to do the outreach and the education so that at that perfect sweet spot, the community member is ready. We're there to be able to vaccinate that community member.
And I'll get you out of here
So we're
on
not going to
this.
throw in the towel just yet on outreach and education.
It's good to hear. It is. Let's get you out of here on this. We've heard these stories about vaccines now having to be or close to being thrown away because they are not being used. There's an excess and the demand's not there. Has Santa Barbara County reached any of those near deadlines for vaccine storage?
No, we have not. We have some minimal wastage due to giving that jab to the community member who's walking up, and we have some doses left over. But we're really minimizing that. I think that with the advent of walk-ins being available and grabbing people, cajoling people, and just catching people at that perfect time has allowed us to really minimize the wastage. And with the leeway from the state in being able to transfer expiring or near expiring vaccines has also allowed Santa Barbara County to be good stewards of the available vaccines.
All right, Von Dobernoso, the Director of Santa Barbara County Public Health, thanks for joining us. We always appreciate it, and we learn something every time, so we'll talk again next week.
All right, see you later.
Take care.